Good morning. Well, I thought I'd do a little update for you since it's been a little while. Um, there's two things I want to talk about today regarding my treatment. Um, Basically, I want to discuss the tablets I was given when I first had my first chemotherapy session, and the symptoms since it's been a week. Well, it was over a week because it was a week yesterday that since I had my first chemotherapy session. What symptoms have I been experiencing? Hopefully, to help anybody else who is um, having to go through this treatment, which is ABVD. And I'll talk a little bit about on the day and what the treatment was like as well. So first of all, um, went into the hospital, and obviously it's your first session, so you're quite nervous. But the nurses are very experienced. Funny enough, the nurse who actually who was the unit manager, administered me the medication, was actually my nursing student, many years ago in the community. So that was quite a nice surprise, and nice that she remembered me. And luckily I was nice to her, hopefully. Anyway, so yeah, quite nerve wracking. They run through all the side effects again and the consent and what each drug will entail. So obviously my combination was 4 drugs. They then talk about the medication that you'll be getting once you leave. So I first of all had an antiemetic, which was on Dansatron. Now I've never had that before, so obviously that was to counteract any effects of given the drugs. So my drugs were an infusion. All 4 of them were an infusion. 3 of them were pushed through a syringe quite well. I'm saying quite quickly, over 20 minutes, I would say each one. And they did do it slowly, but it wasn't a slow drip through a bag. That's what I mean. That was combined with a saline drip. So if you don't know what a saline drip is, it's basically 0.9% sodium, which is salt water, basically, but very, very mild salt. So that was combined with that to help flush the vein through. So obviously you do get, I got a Venflon in my hand. Now, interestingly, there was a student nurse there as well, and I learned something as well. When you're giving chemotherapy, they only put a cannula or a Venflon, wherever you want to call it, in your hand and not in your arm. That is because they can keep a closer observation on irritation of the veins caused by the medication. So, I had me on Danstron. Then they put the first 3 drugs through, and I can't remember what the names of them that went through and which one was in the bag. Absolutely fine. I could feel it, and one of them in particular did feel a little bit like an irritant, if you like, but that soon wore off. Then they put the bag up, the drip, and I believe that one was called venlafaxine. Out of the 4 drugs, that was over 1.5 hours. So once that was completed, they took the Venflon out, and then they went through the medication. So let's move on to the medication that I got. So all in all, I was there probably about 3 hours, 3.5 hours. My partner was there with me, just because I was a bit nervous with it being my first one. I know in some places they don't let anybody in with you, but I was quite lucky in the hospital that I was at locally. Anyway, the staff were brilliant, really good. Moving on to the drugs I took home. So first of all, they gave me, I don't know that's the same for everybody, might be on an individual basis. First of all, I had steroids to take for 1 day only to give the body a little bit of a boost. I then had ondansetron to take regularly for 2 days. That's an antiemetic, remember. So that's to make sure that you're still eating where you can, and you're doing things where you can. They then give you, it's a drug for gout. What's it called? I always forget the name of it. It'll come back to me. Begins with an A. I'll go and have a look at the packet in a minute. So I got this drug for 7 days supply, and apparently this helps drain out the system, flush out the system of the excess cells that are getting killed, if you like. And I'm just coming to the kitchen because I'm going to have a look at that. I'm just going to clean the lens, one sec, because I looked a bit cloudy there. What is the medication? Allopurinol, that's it. I always forget the name of that one. Allopurinol, normally taken for gout. Funny enough, my partner does take it for gout. So yeah, I've had that for 7 days. That finished yesterday morning, so I don't need to take any more of them. You then get an antiviral called aciclovir, 3 times a day, 1 tablet. And you get an antibiotic called tricomimazole or something like that. That is 3 times a week, Monday, Wednesday, Friday, 2 tablets. I had to take on top of that a vitamin D tablet. I'm sorry, I'm just letting my cat in. I've just seen her wandering in the window wanting to come in. That's a vitamin D tablet because apparently my vitamin D was low, which unsurprisingly in the UK. Ali! And I believe that is it. You do get metoclopramide to take PRN. After your ondansetron's finished after the 2 days. Try not to show my chubby neck. I'll leave that door open for her so she can come in when she wants. I'm touch wood. Luckily, I've had small bouts of nausea, very, very mild, which has sort of disappeared quite quickly. So I feel quite lucky that I haven't had to take the metoclopramide as yet. Obviously, we'll have to wait and see the next session, which is next Tuesday, to see if I get any symptoms from that. What other symptoms have I had? Let me think. Oh, well, I suppose I've had a little aching here and there. Sort of like a very mild flu, so it's in your back. My left arm where my venflom's in. A couple of days ago, I did get some aching, very unusual aching in my arm. Now, when I read up on that, that's called chemo arm, and it's to do with the irritation of the vein from the medications going in, the treatments. What else have I had? I've been so tired. Sometimes I've got out of bed, like yesterday. I've been so tired that I've just sat, had a coffee, fell asleep on the couch, got up, just feel like a zombie. Went in the bath yesterday, slept in the bath. I know you shouldn't sleep in the bath. Slept in the bath. So that's the last few days have been like that. I was extremely tired when I got home from the infusion, almost to the point where you feel overtired. So I had to go to bed early, and I did have nausea that day as well. So I sort of buttoned off my tea. So yeah, tiredness has been the main thing for me. But some days I have bouts of energy. Like today, I feel absolutely fine and quite well rested. I have had some reflux, particularly the first night after the infusion. I got quite bad reflux. Now I don't take my lansoprazole regularly, but I did after that night, really bad night. I did take it for a few nights in a row, and now I'm just taking it as I can feel it coming on. So pain hasn't been a huge issue. Probably horrible to talk about this, bowel motions. Um, they have been a bit loose, not diarrhea, been a bit more loose than normal. Sometimes been fine. Um, it's probably all the medication and that you've been on, and probably foods don't help as well. There is certain foods you have to avoid on chemotherapy. Um, and the nurse will go through this. I can't remember every single thing, but some of the spices you have to avoid. So curries are out of the question, unfortunately, unless you're making them yourself and you know what you're putting in. They do advocate for making food from fresh, so you know what's going in it, so you can avoid the spices that you shouldn't be taking. Turmeric is one of them. Um, and avoid processed foods, avoid red meats, which is a bit contradictory because you're supposed to have a very high protein diet as well. But they do advocate for more plant based nuts, things like that. Um, I've just I've tried not to think too much about it. Obviously, I am off the alcohol. Me and my partner is off the alcohol at the minute, and we have tried this zero alcohol wine, which was actually really nice. And I do actually like no secco. Been buying some no secco to have with our meals as well. Um, we do cook most of our meals anyway. We've just stopped any takeaways at the minute, and we don't really buy frozen meals. Um, so I suppose we are eating the same as usual. We're just being a little bit more careful around some of the the content. Processed meats out of the question. You're supposed to reduce your red meat. It's been quite nice. I mean, it's a bit cloudy today, but it's been quite nice the last few days, and they do advocate firstly protecting your skin. So the moisture, you have to use body lotion because you can get dry skin from chemotherapy. So I have been moisturising my hands and my face particularly, and the moisturiser I use does have a SPF 15 in it. If it's particularly hot, I have got a factor 50 I can use if necessary, because you are prone to getting melanoma, skin cancers, that sort of thing. Um, so yeah, like I said, I can't go through every single thing I was told to avoid and what to do. I'm just telling you as I remember them now. Um, so yeah, I'm feeling absolutely great at the minute today. Hopefully my energy levels will stay tip top. I haven't been, although I have got opportunity to work from home, I haven't been at the minute. I think I had 2 days when I was on steroids, where I was working from home on the laptop. But I've been far too tired to even work from home since then. One point about the steroids. Now, it does say to take twice a day, and I took mine at 9 o'clock and about 6 o'clock on the night. I would, after talking to my friend who's a doctor, I would have took my evening dose a lot earlier, only because I could not get to sleep on the night. Um, it was probably about 4 o'clock in the morning when I finally started to drift off because of the steroids giving me a boost of energy. So yeah, if it says twice a day, take your evening dose earlier than what I did. Um, but yeah, things are going well. I've got my blood test on Monday just to check my white cells, my red blood cells, make sure everything's fine for me to have my next treatment on Tuesday. That'll be 2 weeks. Once I have that treatment, that'll be one cycle down, which is halfway through my treatment. After that, I'll only have another one cycle, which is two treatments, 2 weeks apart. Fingers crossed. And I have been feeling this lump here on my neck, and it does feel smaller. I can't really feel the one at the side anymore. So fingers crossed, if things are going well, I can then move on to radiotherapy and go into remission. That is the hope. That is the hope, and hopefully it'll be quite quick. Ali! Oh, my cat, I can hear my cat. Oh, and I can hear somebody coming in. So bye for now.